Dr. Don Jewell. Today I'm making this video to explain how we use the Zerona laser in our clinic. So this video is for our patients, new and old, who want to know more about the Zerona or be Zerona candidates. So Zerona laser, I'm Dr. Don Jewell, and for the non-surgical clinic. Zerona is a true cold laser. So most people don't understand this because of the way it's presented online. So we're going to explain a lot of Zerona basics. It's a 635 nanometer red laser. Okay? 635 nanometer red lasers, these are true cold lasers, FDA approved and clinically used for many applications, not just simply body contouring. Okay? And we're going to get this right out of the gate right away. Key point, this is not an LED light device. This is not laser like lipo. Okay, that's a different thing. This is apples and oranges. So laser like lipo is not what we do. Okay, even though some people perceive Zerona in that manner. LED light devices we consider sham devices. So sorry if that offends some people. There's 3 true cold lasers right now available at this time. There's a red 635 nanometer, green 532, and purple is 405. Okay, so in our clinic, you'll hear us talking about red, green, purple, and very few clinics have all 3 lasers. You'll find some clinics with red and purple, some with only red, some with only purple, and some with only green. The green is the most coveted. Very few clinics at this point in time will have all 3. Okay? FDA approval, 2008. Seemed too good to be true. Okay? But the Zerona is science-based. It's reproducible and quantifiable. Okay? But at that time, plastic surgeons, they do surgery. So who would do the Zerona? Who would do this procedure? There was no clinic for the Zerona, at this point in time. It's Zerona. Who does it? Who do we think does it the best? Functional medicine doctors who happen to specialize in true cold laser therapy. So our clinic was born out of necessity, the non-surgical clinic. It's a clinic based on restoring the gut-brain axis. This is Functional Medicine 101. Health restoration and upregulation on the cellular level. But we only use FDA-approved devices. So I'm going to tell you right now, most clinics that do the lipo laser thing, either with a Zerona or with one of the LED light devices, this is like an adjunct. They throw it in a back room and they go to a weekend thing and they pick up one of these things. Our clinic was specifically designed around cold lasers. These are our paradigm shift devices. These are where we begin to work at the cellular level. We're a clinic based on cold lasers. And most clinics simply just do this as an adjunct, where this is actually what we spend our time on. Okay. Another big key component to the Zerona, or the body contouring procedure. It's a whole body healing event. So this is the first video. I cut the videos in 2 because there's a lot of information and we want patients to be highly educated. So in the other video, we're going to show you a whiteboard and we're going to use the original marketing video and show pictures. But the Zerona, where we place the laser, doesn't just affect the body in one area. It spreads through the whole body. So this is where a lot of people, once they see the photos, are like, this makes sense. But the Zerona does more than most people realize. It's just working on the cellular level. Okay? It's not simply about fat emulsification or lipolysis. Then another big thing, patience. This is a healing event. You have to give this 28 days to process through your body. You didn't get this way overnight. You didn't get this way in 2 days. You're not going to get out of it in 2 days. You need to give this time. Give it 28 days. I don't care what you're going to do in life. If you're not willing to commit 28 days to it, then don't do it. Okay. Laser therapy has 2 main healing components. Okay. Restoration, which is dramatic. So we have a lot of patients that come in with acute trauma, injury, etc. We use cold laser in that for those patients. The upregulation is both dramatic and subtle. We call this climbing the ladder and riding the wave. So as you get deeper into cold laser therapy, you realize there's a lot more to this because we're working on the cellular level. Okay? Zerona patients for body contouring experience both restoration and upregulation. The Zerona not only achieves the coveted spot reduction, once only considered available through surgery, the Zerona induces a healing event on the cellular level. powerful. So we explain this because when our patients go through this process and their body begins to change, and you watch the video called The Healing 5, all this makes sense. Okay? So the Zerona, very powerful, a lot more going on than most people perceive, but ultimately, the best things for patients, what they need to remember, is no pain, no surgery, no downtime, best of all, no scars. You come in, treat, and off you go. It doesn't interrupt your day one bit, and there is no recovery. The science, how does this work? Photobiomodulation, phototherapy. It's similar to the way the sun hits your skin and causes your body to make vitamin D. And so it's very simple. Lasers invoke the restoration and upregulation throughout the entire body, even though we only may place it in a certain area. And we tell our patients, think of it in this manner, like a pebble thrown into a pond, and the wave spreads through the body. Okay. How do we apply it? Well, real quick, I'll tell you, there are no constants in laser therapy. There are variables. Okay. We will start anywhere from 0 to 6 inches away from the body. Okay. The laser does not differentiate between cell types. I had a patient ask me this yesterday, how does a laser know the difference between a fat cell, muscle cell, etc.? It doesn't. It has a different effect on each cell it finds. Okay? This is where a laser doc gets very good, and they're looking for the patient's response. Okay? The biggest thing why lasers are so powerful is the 635 nanometer oscillation, which we'll get to. When the Zerona finds a fat cell, the transitory pores open. The fat cells have a very thin porous membrane, the soft fat does, and the laser opens it up and emulsifies the fat. Now the whole secret is, where does this fat go? It has to go somewhere. It doesn't magically disappear. Okay? You're not going to lose 2 inches of fat in 20 minutes, even though some devices claim so. You're going to move it. So it has a journey. Key point, treatment time is not a constant. Okay? Remember, our one study in 2008 for the FDA approval, 6 doses, 40 minutes, 2 weeks. We did everything the same to get a baseline to show that this works. A good laser doc will adjust not only laser placement, but laser dosage time. And we tell our patients, think of it in this manner. A glass of water for each patient. Patient A may need 28 minutes to fill that glass of water. Patient B may need 42 minutes to fill that glass of water. The doctor's job is to get results. The patient wants results, so does the doctor. Okay? This is where most people get lost because they go online and they read something. Okay? Remember, the internet is not diagnostic. Okay? It's good for information. Patient A gets a full glass of water, 28 minutes. Patient B gets a full glass of water, 42 minutes. They both get results. Then we stop applying the laser because the glass of water represents your lymphatics. Once your lymphatics are full, there is no point in applying more laser until we drain the lymphatics. So that's a clinical pearl. Okay? So then, this is something we'll explain as you treat, and it makes more sense when you're here. Okay. Emulsified fat and everything else that's inside the fat cell that's been stored there, toxins, hormones, it's released. Okay? Extracellular space, and it begins its journey. So each treatment we find clinically takes 3 to 5 days for the patient to process. So if you have 3 treatments, you're looking at 9 to 15 days. 6 treatments, 18 to 30 days. It takes time. It depends on the patient. And here's the journey. It goes to the lymphatics, then to the liver, then to the bloodstream to be burned off. Okay. Fat cells remain intact and healthy. This is what's great. We do not shock your endocrine system. Your endocrine system stays healthy and alive. Okay, we simply deflate the fat cell. Okay, and all the stored fat and toxins leave and begin to be processed. Here's a huge key point. True cold lasers do not cause any unnatural health reactions. They simply mimic what a healthy body does when the gut-brain axis is functioning. And so you remember restoration and upregulation. So as I ask our patients, when you're coming in for care, what are the 2 things everybody has told you to do to lose fat and or weight? Well, typically they say diet and exercise. When diet and exercise cease to work, most patients don't realize they have a bigger problem that hasn't been found. So we look into that. Okay, so the journey. Lymphatics. They pick up the released fat, toxins, hormones, etc. Transport to the liver. Okay, the liver has to do a process called hepatic biotransferation. transformation. That's just a big fancy word of the liver functioning, working, doing its job, converting everything, getting the fats back to a usable fuel form, putting them into the bloodstream. Once the fat is back into the bloodstream, it's triglyceride, now it can be burnt off as fat. A lot of patients come in, and I don't know where they're hearing this, but they kind of think when they go to the bathroom, the fat comes out. That is not what's going to happen. Actually, that's a time when you need to go to the ER if that would ever happen. We've never seen that. No, the fat has a journey. And remember, the laser doesn't cause anything unnatural. So we're just going to restore and upregulate a natural process that has ceased for some reason. Okay. So in our clinical protocol, we refer to this process as stages 1, 2, and 3. We'll talk about a patient, you're in stage 1, you're in stage 2, you're in stage 3. We're going to look at your body scans. We're going to look at you. Okay. This is the restoration and upregulation of the gut-brain axis. Key point, if the liberated fats, toxins, hormones, etc., at any stage in this process aren't able to complete to the next stage, meaning if they can't go through 1 to 2, 2 to 3, then the fat's going to go right back where it came from. Okay? This is where patients who have gone in for this procedure and haven't had great results have had difficulty completing stages 1, 2, and 3. This is why functional medicine doctors who specialize in cold laser do very, very well, because they understand where the patient is in the gut-brain axis, and we're applying functional medicine to what was once considered a purely aesthetic procedure. Okay. Restoration. When diet and exercise no longer work, the gut-brain axis is broken. Something's gone wrong. Typically, we find a patient is in a condition we call systemic inflammation, meaning it's everywhere in the body and they're inflamed. If you have systemic inflammation, which 99% of the patients coming in for this procedure do, nothing's going to work. You're chronically inflamed, which leads to a state of being metabolically sick. So we tell everyone in our clinic we practice functional medicine, and we treat autoimmune conditions, chronic degeneration, etc. Before I was in functional medicine, I was the guy who ran out on the field, scooped up the athlete, made the on-field assessment of, can this athlete go back to the game or should we go into the ER? That's what we call allopathic care. We are the best in the world at traditional medicine, meaning allopathic care. You have a broken arm, heart transplant, C-section, etc., this is where you want to be. But if you have a chronic degenerative condition, an autoimmune condition, or if you simply can't lose weight or maintain your health, we are the worst. We're 50th and dropping. So this is where cold laser and functional medicine step in, because we induce restoration and upregulation to these chronic patients who've been suffering. This is where the Zerona gets bigger than most people realize, because we're working on a cellular level. You're still going to get what you want, which is the introduction, but there's so much more that comes with this. You need to be educated, because it's very dramatic, but yet subtle. And that's a hard concept for us to explain, but now we moved into the second phase of what we consider our Zerona history is. We've been doing this for 10 years, 5,000 patients. Now what we're doing is we're training doctors to do what we do, to do this Zerona in our manner and follow our protocol. And the docs that do it love it. They're finding this is a whole new patient base that's underserved. This is an exciting world of functional medicine. Okay. So the laser, specifically the red 635 nanometer laser, works first in the mitochondria of the cell. So we're going to talk about the Krebs cycle. The laser increases the Krebs cycle activity about 66%. Okay? This produces more ATP, which is adenotriphosphate. This is very powerful. This is what we call the essence of life. Okay? This is restoring ATP production, which is dramatic, then upregulating ATP production, which is both dramatic and subtle. Once again, we can call this climbing the ladder and riding the wave. Okay? Krebs cycle in the mitochondria of the cell, essence of life. We take a neurometabolic approach to our Zerona treatments. This means we're going to look at the neurology and the metabolism of the patient to see why diet and exercise are not working. Okay, we can also take a look at your DNA through telomere testing. The website at this point in time is telomereyears.com. You can have yourself tested with a drop of blood to tell you how old you actually are. It's your physiological age versus your birth age. It's pretty amazing. Okay. So since the Zerona begins with the Krebs cycle, we're going to talk about the Krebs cycle. Okay, remember, mitochondria of the cell, here's where the Krebs cycle resides, the powerhouse of the cell. This is where you live. The Krebs cycle is so important in medicine that everybody in medicine in our basic training classes in science we have to not only memorize the Krebs cycle, we have to draw it out from scratch on a piece of paper. And I did that in doctor school the first time out. I just simply regurgitated it. When I became a functional medicine doctor, I went back and relearned the Krebs cycle, not in just pure fact regurgitation, but exactly how this works and why the laser is so powerful here. Okay. Time diminishes your Krebs cycle. We're all aging. We can't stop that. You lose about 1 to 2% of activity or function per year after you stop growing. Okay? Malnourishment. In our country, we are chronically overfed and malnourished. Our food simply isn't what it used to be. Okay? Inflammation attacks your Krebs cycle. We are in an opioid crisis right now. People are in chronic pain. Inflammation is shutting their bodies down, and we live in a very toxic world. So we have all these things constantly attacking us, and our Krebs cycle is taking a beating. Okay, that's the bad news. Next, here's the good news. Krebs cycle vitality improves with oxygen and activity, so we get our patients to breathe again. We get them moving again. Okay. Nourishment. We have specific nutraceuticals specifically formulated to upregulate and nourish the Krebs cycle. Okay. Anti-inflammatories. This is huge. Your fish oils, EFAs, turmeric, curcumin, glutathione, etc. All these things help your body. We've got to get rid of inflammation. And last but not least, there are over 3,500 articles and counting on PubMed proving that cold laser therapy enhances Krebs cycle activity and function. Okay? This is a very exciting time in medicine. Cold lasers have been around for over 15 years and counting, 10 years for the Zerona, but it's still a young and growing world. Okay? You're not going to hear this in traditional medicine, but it's out there, it's quantifiable, it's reproducible science. Okay? Now back to the Zerona. Our patients not only experience the lipolysis component, they experience what we call the 5 healing components to a Zerona protocol. So we're going to go through this. The first is more energy. Patients love this. They're going to love having more energy. This is because we have more ATP coming out of the Krebs cycle. Second, less inflammation. I can't tell you how many patients have come in for body contouring who've had chronic degenerative conditions or chronic pain. They're like, hey doc, I'm losing inches, but I've had this back pain and I've had physical therapy, traditional chiropractic, injections, and et cetera, and all of a sudden after a couple doses, what's going on? Because my pain isn't what it used to be. So this is where the laser goes to work. We have a video explaining how laser deals with inflammation. So a lot of docs that I train simply just use cold laser therapy devices just for pain because there's such demand, okay? Now we start to move into what we call no man's land, because when you transition from, say, a broken arm patient will do whatever their doc says to heal. You start to transition to an aesthetically based patient. Things get different, and this is why the Zerona doc has to slow things down, manage expectations, because aesthetics patients have a different mindset than acute care patients or chronic autoimmune patients. But the Zerona gets powerful, and when you watch the video and we show the pictures, you get improved muscle strength and tone. Okay, so right now at this point in time, I know there are certain athletes getting cold laser before games. Okay, there are certain people that are trying to figure out should this be legal or not because these athletes are upregulated and they win. Okay, improve skin tone and texture. Okay, the strength of your skin will get thicker again. As we age, our skin becomes thinner. This is aesthetically dramatic. It's phenomenal. Patients love this. This takes about 4 to 6 weeks to set in because your skin has a growth cycle. Last but not least, we get what patients come in for and what they typically assume all the Zerona does is lipolysis. In the early days of Zerona, I'm chuckling because I had conversations with specific doctors who said, oh no, that laser only does this, this, and this. I'm like, you have not read any of the literature, okay? But you have to remember, this is very young and organic, and there's not a lot of laser docs out there who not only have a laser, but it's the focal point of their clinic, okay? The lipolysis, the fat reduction, or the inch loss. That is component number 5 to the healing process, not number 1. Okay, so all the patients experience all these things. As the body goes through this healing process, the inch loss sets in, but you have to remember this is meant to be a 1-month process, not a 2-day process, okay? And these 5 healing components, this is the key point, and this is why we don't even bother with LED light devices. You can tell I get a little worked up when I even think about them, and we'll talk about that in a bit. This is what sets True Cold Laser, Zerona, Virtue, EVRL, all our real lasers, light years ahead of all the sham devices. This is what true cold laser therapy does. LED light, or laser-like lipo, I don't even know who made up that word. That would be me like saying, oh, I'm going to drive my Ferrari like Yugo down to the grocery store. This is what sets us apart. This is apples and oranges. This is why we love our laser. This is why we're very driven in this manner when you watch people heal on this level through these 5 components. Okay. So here's our protocol. This comes in our patient folder, so we're going to walk through it. Okay. Remember, there's a lot of information about Zerona. That's why I'm shooting these videos. That way patients can watch at their leisure and be educated. For 9 months, I postulated this protocol. I thought about it. You have to remember, when the Zerona came out, there was nobody to copy. There was no Zerona clinic to go to and shadow a doctor. Now I have doctors shadowing me every couple of weeks to learn how to do this. But in 2008, there was no one to go to. Not even the manufacturer had anywhere to go to. Okay, so I took 9 months, began to research and think and go through this. So it's been 10 years. That's why we're shooting videos now. Okay, I could have shot videos 5 years ago. I specifically waited 10 years. Okay, 2008, 2018. Okay, over 5,000 patients. We're pretty confident in what we're doing. We have seen everything clinically. So when I say something about a competitor's device or a different device, I'm not saying it flippantly. I've had them all in my clinic. I've used them all. None of them stack up to a Zerona, period. They'll say it's new technology, it's different it's Home Depot technology. Zerona lasers have ruby crystals. They have white noise. They're powerful. So we're going to move on from that. We've been through everything with Zerona. In the heydays of Zerona, we had 7 Zerona lasers running all day long. I would average 50 new patients a week just for Zerona plus my other patient load. Okay, so we're very confident saying the things we say because we have been there and back with the Zerona. Okay, the patients that adhere to the protocol that we're going to go through get 2 to 3 times higher results than the national average. Okay, everything we're going to explain in this protocol enhances your Zerona experience. You take the Zerona as far as you want. Okay, you can come in and simply have the laser put on and off you go. That's fine. Here's everything that will take it to the next level. So we start with every patient in my clinic, it doesn't matter who they are, with a metabolic assessment form. This is a subjective metabolic assessment. Okay, the patient fills it out. This is a health history. I almost feel like a good health history is becoming a lost art and science in medicine because this will give you the diagnosis if you get the information. Okay, more importantly, this is where the patient currently is in health. Okay, and how each individual perceives their own health. I can't tell you how many times I've had somebody in chronic pain are like, oh, okay, I'm healthy except for the cancer. It's true. That's a direct quote from a patient. Okay. We quantify this with the executive comprehensive blood panel for our advanced care patients, not our basic body contouring patients. In functional medicine, we start with proper testing. Proper testing is 8 vials of blood plus your analysis. From there, we move on to food sensitivity testing, genetic testing, etc. If you can't quantify your problem, how could you ever begin to fix it? Okay? But basic body contouring patients, we simply start with a good subjective history. Next, we take a Fit3D full body scan. This is an infrared camera. It's from fit3d.com. We love this device. I wish it had existed when Zerona came out. It did not. We had 3 or 4 years or more, I can't even remember at this point, where we manually measured patients with muscle tape. Okay, when the Fit3D came out, I bought it immediately. It's an infrared camera that scans your body head to toe, creates a 3D image that rotates. It's amazing. We love this technology, and it gets better every 6 months or so. They upgrade the device. Okay, it's an infrared camera. Your measurements at home are not going to trump this device. Okay, but that's okay because you can watch your body heal. So for our advanced care patients, I had a patient came in for his thyroid, and we did the 6-month thyroid protocol, which features the Zerona, Virtue, and the other lasers. In 6 months, he lost 50 pounds and 33 inches. We were able to go through his Fit3D body scans and show them exactly what was happening. Okay, the very first part of his laser therapy for this restoration protocol was very dramatic. That's the restoration. Then he went through a period of it being dramatic because he had all the 5 healing components, but it was yet more subtle because he began to ride the wave of health. So my advanced care patients understand this as they get into this upper regulation components. of laser therapy. We love it. Last, because you can stack your scans up, you can track your history. You'll have these scans for the rest of your life. A lot of my patients who go on a vacation, slip a little bit, fall off the wagon, come in, rescan, okay, here's what I lost, here's what I need to get back to. Or patients who try something new, come in and scan, say, hey, this is working, I'm maintaining or continuing my results. We love the Fit 3D body scan. Okay. After we complete the MAF, Metabolic Assessment Form, and the Fit 3D body scan, because remember, we're building your file. Okay, here's the other thing. When we take a Zerona patient on, we don't just have you sign a dotted line, sign your consent form and treat you. You're highly educated. We consider this to be a medical procedure. We don't consider this something that should be done in the back room of a clinic with no education, without any thorough management. There are places that do that. Okay, we're not saying that's wrong. We just don't feel that's right. Okay, after we build your case and we get to know you, okay, we have to know what your expectations are. We have to know where your health is. We ask simply this: what has brought you to this point in your health? We have to figure out what's brought you to where you are, and we have to make some changes. Okay? Without addressing these issues, your results probably aren't going to last or be attainable, because everyone always asks, oh, is this going to last forever? Well, is working out once going to last forever? Is getting one haircut going to last? No, it's a lifestyle management. Okay? Biggest thing with Zerona patients are expectations. Are we even going to address them? Of course we are. We have to know what your personal expectations are, what you're hoping this procedure is going to do for you. And are they realistic or not, okay? We address this dramatically, trust me, because the internet is terrible for people self-diagnosing, self-treating. The worst thing a patient can do is watch a pharmaceutical commercial, go in and tell their traditional MD, here's what I need because I read it online, or saw a commercial. My friend who's an MD gets that question 20 times a day. They love it. No, I'm teasing. Key point, what we have found in the last part of our 10-year Zerona journey, there's always something larger, there's always a bigger problem. When diet and exercise cease to work, the patient's in a state of systemic inflammation becoming, or they may already be metabolically sick, but traditional medicine doesn't pick up on these things, because in traditional medicine, you have to get sick before you can get better. So in functional medicine, we're looking at what's going on with you head to toe, A to Z. We're not waiting for it to manifest so we can label it and medicate in surgery. We're trying to actually work before the problem develops full-blown allopathically. This is why I loved being in sports medicine, working with my teams, because I was in concierge medicine. It just didn't have that label. I was with my athletes every day. I knew what was going on with them emotionally. I knew what their diet was. I knew what their workout routine was. When they got hurt, I was there. I still have athletes call me to this day from 20 years ago when I was just an undergrad being their athletic trainer, and they want to come see me for healthcare, okay, because I'm their concierge. So I love functional medicine. We become a team, and when your doctor knows everything about you. Okay. Number 3 is a no-brainer. No alcohol, no smoking. Okay. These are things that are very, very bad for your health, and you're trying to get health results. You're trying to induce a healing event. You can't do that if you're continuing bad habits. Now, if you're trying to cease these things, we can treat. My friends who are neurologists will not take any patients who smoke, because they know these patients are not going to heal, and they can't afford to have patients who aren't healing. Okay, it's bad for them when they're stuck in that insurance paradigm. We don't deal with insurance, so unfortunately, we can take those cases. Alcohol kills liver enzymes. Okay, the whole goal is through stage 1 and 2 is to get the fat to your liver. If the liver can't do its job, where do you think this fat's going to go? It's going to go right back into storage. Smoking kills everything. This is a no-brainer, right? Okay, smoking more specifically goes after your Krebs cycle and induces major damage. And all we're doing is trying to keep up with the new damage that's being induced. So these things really, everyone's like, well, okay, alcohol is a social event. Plan your social calendar around your Zerona treatments. If you want results, we have the protocol. If you don't adhere to it, there's not much we can do. We can tell you, but we can't do it for you, okay? So, to recap, liver is stage 2 for the fat and everything else. We've got to get it through there, okay? So that's hepatic biotransformation. That's just, I didn't make that word up. That's just the word that talks about the liver doing its job or functioning properly, okay? The lymphatics, here's a great thing for your body scans. We are going to watch your lymphatics. Now, we're also going to physically look at you, okay? They're going to swell. That means they're going to fill with fat. This is stage 1. Here's a little secret. This is the whole water and the glass analogy. Once your lymphatics are full is full, we're going to stop treating so your lymphatics can empty, because if we keep treating, that fat is just going to overpour and go right back into extracellular, back to storage. Okay? True story, I can't hear, it's been so long, probably 2012, 13, somewhere in there, we had a doc who had a Zerona in his clinic. He treated everybody every day with a Zerona, and he said, well, this doesn't work every day. And then we said, okay, let's figure out why. So for 6 months, I treated 100 people specifically every day. What we found was lymphatic clearance was the issue. If the patient can keep pace with lymphatic clearance, they can treat every day. If they cannot, we need to give the body time to process. So remember, when the Zerona came out, there was no one to copy. Everything's had to be done clinically, okay? And everyone's like, well, why don't you do research? And do you know how boring it is to do research? I'm a clinician. I love being in the trenches with my patient. Research doctors, when I was in Pittsburgh in the lab, they have, God love them, you're great, you do great work, but you have no personalities. I like being in the trenches with my patients, figuring out, give this clinical information to the researchers, let them go do the articles, okay? Clinical research is boring for me. It's great, we need it, because it quantifies what we do. But there are two types of docs, and anybody in medicine will agree. There are researchers and clinicians. Okay. Stages 1, 2, 3, we have to get it through those. So you can see this Zerona's very big. We're very passionate. We love this Zerona. We love cold lasers. We love watching patients heal. But we also understand there's a huge learning curve here, and patients need to understand what's going on. Okay. Nutraceutical support. Okay. Remember, everything here is to enhance your protocol. Our original patients all took niacin, vitamin B3. Tons of information online. Research it, talk to your traditional doctor about it. It's a vasodilator. It aids in increasing blood flow, which helps you burn more fat. It's a very simple thing. Now, niacin will make you bright red if it's pure niacin and not time-released. We use a time-released niacin that keeps a steady supply of niacin in your bloodstream, which we find is the best for Zerona. Remember, we've tried them all. You want to keep a high level of niacin, but if you're on medication, you'll talk to your traditional doctor about that and make sure it's okay. Now, we also use nitric balance, which is pure ATP. This is a functional medicine product or a nutraceutical product. It's phenomenal. It's pure ATP. We call it the fountain of life. Okay, it aids in increasing blood flow. We sell so much of this we can barely keep it in stock. This will increase your metabolism. We use it for a lot of other conditions outside of body contouring. Now, Clearvite and Mitocore are nutraceuticals specifically formulated to nourish your Krebs cycle. So I have a video where I talk about oxidative stress and the Krebs cycle. I go into more detail about this. Okay? Then we also use the autoimmune or paleo diet when patients want to induce medical weight loss. But you have to remember, body contouring, medical weight loss featuring Zerona are not the same thing. Body contouring will induce 5 healing components, but as you're building muscle with the laser and removing fat, weight loss is not the key point we're working at, because muscle weighs more than fat, okay? It's that simple. Don't get hyperfixated on any one thing, and remember, body contouring and medical weight loss are not the same, but you can induce medical weight loss with the body contouring, but you have to do diet and exercise that actually work for your body type, okay? So, water. Yes, you need water. Americans are chronically dehydrated. So it's very simple. Here's our formula. Take half your body weight, and drink that many ounces. So if you weigh 150 pounds, divide that by 2, drink about 75 ounces a day. Okay, the whole 60 ounces a day is good for everyone. That's the old thinking. Okay, would still be good for everyone because they're probably not getting that. But you need what's optimal for your body type, but not more than 100 ounces a day. You can get water sickness if you drink too much. Okay, key point. This always happens, and I kind of go through this on the whiteboard video, which is part 2. Constipation may occur in some patients, and you'll see me pointing at the villi in the GI tract. What happens is the villi fill with tar. And this is where most Zerona patients will have 5 to 10 pounds of tar in their gut. Okay? What happens is because the Zerona is healing, this tar becomes loosened, and it comes out and begins to constipate the patient. More so, this tar, if it's been there long enough, it's scabbed and scarred the villi, and these scabs break off, and they come out, and there's constipation with that. The simple remedy is a bit of magnesium and vitamin C, GI massage. When you're here and we're looking at you and we're saying, okay, have you had a bowel movement, how's your tummy feel, etc., we're going to look at you. I clean up a lot of train wrecks where patients go into a laser like lipo, LED light sham clinic. They do some vibration therapy that gets their gut moving, but they've had so much tar. This tar sits, and this patient hasn't gone to the bathroom for a week or two, and nobody thinks that's a problem. We get these patients under the laser, and I'm not making this up. We get them under the laser immediately. We free up everything. We upregulate the Krebs cycle. They have a bowel movement, feel wonderful. I can't imagine ever calling my doctor and my doctor saying, 2 weeks is okay. That's not okay. And remember, when you're dealing with this type of things and people are trying to do what we do but not doing what we do, they can make strange things happen to your body. Okay. Aerobic exercise. Yes, you have to work out. Okay. If you want to do something with this freed up fat, you've got to burn it off. Okay. 45-60 minutes of proper fat-burning aerobic exercise about 3 times a week. Okay. That's not hard. We tell our patients go for a 45-minute walk. Okay. But you got to burn this fat off, because if you don't burn it off, you're in stage 3, the fat's in the bloodstream, it's liberated, it's ready to be burnt off as fuel. If you don't burn it off as fuel, then it's going to be restored back in the fat cell, which you do not want. You want results. So yes, you have to do something with it, okay? We have our patients do oxygen with exercise. Oxygen is fuel, raises their metabolism, helps to burn fat. We also do high-intensity interval training on our vibration therapy devices, okay? Patients love vibration therapy. We'll talk about those in a minute. 1 minute hard, 1 minute easy. It raises your metabolism, helps burn fat. We also have our patients do things like hot yoga to get the body into a different state, okay? Now, vibration therapy. We love this. Just about anybody doing the Zerona will have a ViPlate. This is one of the first things we figured out to put in the protocol. So this helps your body do something with that fat. It's also called, by doctors who use it, neuromuscular re-education. We use it in physical therapy, traditional chiropractic, etc. for neuromuscular re-education. Okay? 10 minutes is like a half-an-hour workout. You stand on this plate, it shakes. You've probably seen these at trade shows and etc. A lot of our patients buy one for home. These are great. They're a jump start or a restart for your metabolism. They get you up and going. Get those endorphins and the cephalons in the bloodstream. Okay? This is NASA-proven science. This is in the Olympic Training Center in Colorado. It's proven and reproducible and quantifiable. It's a no-brainer. Okay, so you can research vibration therapy. There are plenty of articles that can take you as far as you want and as far as detail as you want. Okay. Another little secret, compression garments. You've seen a lot of athletes wear these. Okay, it helps lymphatic drainage. Okay, a lot of we tell all our flight attendants, wear these things. You're going through pressure changes. Okay. It aids the lymphatic system, clearing the fats, toxins, etc. Okay? Just choose a garment, now remember, you don't have to, this is up to you, that covers the treatment area and beyond. Okay? This is going to help your lymphatics move this fat to your liver. Okay? But you don't have to wear it all day. You don't have to wear it 24 hours. Remember, this is just an adjunct therapy. This just enhances the Zerona. So we tell patients 6 to 12 hours a day, whatever's comfortable. You don't need to sleep in it, but you can if you want to. Remember, it's just something that takes it up another notch. Okay. So the Zerona. Remember, we're restoring and increasing lymphatic flow is crucial. And this is crucial because the majority of patients that come to this already have a lymphatic system that's compromised. It's not flowing. It's not moving. It's plugged up. It's what we call frozen. We've got to get it open because we've got to get all this fat through it. Okay? It's stage 1 in the process of getting results. Compression garments, body rollers, massage, specifically lymphatic massage, intersegmental traction, etc. This is where we start to go into the neurometabolic thing and get things moving again. Okay? Water and niacin will help here too. So everything in the protocol is meant to be synergistic and help the patient get results. Remember, we're a results-driven clinic. We want you to do well. We're going to educate you. And the best thing about the Zerona, you have to still remember, I know it's a ton of information. There's no pain, there's no surgery, there's no downtime, best of all, no scars. Scars are forever, okay? True story, a while back, because plastic surgery has noticed Zerona, they knew about it right out of the gate. There is a franchise that has a cold laser device. This is a plastic surgery franchise. They take a cold laser, they put it on the end of a cannula. They insert that cannula and do traditional plastic surgery procedures because the laser liquefies the fat as they go through the tissue, and they remove it. But see, you don't have to do that anymore because your lymphatics will simply clear that fat. But you have to remember, surgeons do surgery. That's what they're good at. That's where they're skilled. They do phenomenal. Here's the deal. If I ever needed surgery, this is the country I want to be in, okay? our surgeons are the best. They are phenomenal, but they do surgery. They wouldn't want to spend all that time and money going to school to be a surgeon to do a non-surgical procedure. I don't see that working. So that's why when the Zerona came out, it really kind of fell into a void of who would do this, because it's doing something that was traditionally thought only capable through surgical procedures. And that's why the Zerona politically really blazed a trail, and that will be a whole other video if we ever choose to shoot it, of a lot of things happen. And that's why the Zerona has a love-hate relationship. I'm going to tell you, anything out there that's trying to do body contouring things, they are all the poor man's version of the Zerona. That's going to offend a lot of people. I'm sorry, but it's true. Okay. Everything we're telling you is going to help improve the efficacy of the Zerona. We want you to do well. Okay. So, adding medical weight loss to the Zerona protocols is very easy. We have to do two things: diet and exercise. Well, you've probably tried a bazillion programs, spent a lot of money. Forget calorie counting. Those days are over. That's archaic medicine. That's old thinking. That is the biggest loser mentality, grind yourself into the ground mentality. That doesn't work. It's not sustainable. But those programs have been around forever. They're very well known. They generate countless millions of dollars. The new medicine is anti-inflammatory diets, paleo diets, good fats, etc. Okay, this is the new quantifiable medicine. This is why functional medicine is exploding. Make sure your doctor actually has some functional medicine training, isn't just throwing that term out there. After I graduated from doctor school, I went back and became a functional medicine doctor. This isn't what's taught in traditional MD school or DC school or PT school. This is another step above and beyond, okay? All these things are different. I'll tell you, we have a phenomenal trio. Niacin, nitric balance, and CM Core will induce massive fat burning capability in our patients. And they do very, very well with this. And when you're a patient here, we talk more about that. You can also find these products through our online store. Okay, detoxifying, I don't even like that word because there's so many terrible detox programs out there. We prefer to call it hepatic biotransformation, which simply means restoring your liver to a healthy state of function, cleansing it so it can do its job. If it's 2018 and you live in our country, your liver has taken a beating, period. We live in a toxic world, okay? Core Restore program is phenomenal. A lot of my patients, we have to do a 1-week liver cleanse just so they can handle the Zerona procedure because their liver isn't healthy enough to handle what's coming with the Zerona. Remember, with the Zerona, you're going to have 3 to 5 times more fat liberated into your bloodstream. So year 1 of Zerona, remember, we're figuring all this out. There's no one to copy. We've got our basic FDA approval study, and that's it. Okay? And that's part of the reason, well, that's a whole other video. So I'm thinking about everything we've been through to do what we do. Okay, so I take the Zerona. I treat myself. I do the standard 40-minute treatment like I'm supposed to because that's what it says in the FDA study. But before that, I tested my blood. Okay, I treat, and then the next day I retest my blood. My triglycerides before Zerona. These are free-floating fat in the bloodstream, about 125. Okay, I do a full Zerona treatment. Wait a little bit, retest my blood. They skyrocket to 350. Okay, had my traditional MD looked at my blood work, they probably would have had a heart attack because they were thinking you're going to have a heart attack. But you have to remember, triglycerides are just free-floating blood molecules, or sorry, fat molecules in your blood. You need to burn them off as fuel. Okay, that's what the Zerona is supposed to do. So remember, everything we were telling you is a 10-year journey. We just decided we're going to go 10 years, and then we're going to start talking about this. Okay, I know it sounds crazy. Okay, so we've learned a lot, okay? And we deliberately just spent time learning about this. Okay, so everything I'm telling you, trust me, it works. EB Pro Ionic Foot Baths. These are made by the same company that makes the Zerona. We love them. Okay, you can read all about it. These are devices that actually cause your lymphatics to increase flow, etc. We're going to repel things out of your body. Clinical Pearl. Okay, because a lot of people right now are like, oh, those don't work. Okay, well, we test patients' pH before a foot bath with the pH testing strips. Patients who are acidic or slightly acidic always move more alkaline after a foot bath when we test their pH. That's how we clinically prove it. You can read all the information at Herconia.com about the foot baths. We love them. They enhance the Zerona experience. They're They're just mandatory with our advanced care patients. Okay? Oxygen therapy. This is a no-brainer. We use very low level, 5 mLs of oxygen to get people breathing again. We also teach breathing exercises. Oxygen is fuel. Oxygen is life. Vitamin D. So remember, I said we are #1 in the world for allopathic care, or what I call hero medicine. Talking about vitamin D with a patient is not hero medicine. Vitamin D is mastery of the basics. Okay, so we have mastered the basics. Talk to anybody in any industry, it's those who have mastered the basics can conquer the industry. Vitamin D costs 5 cents a dose, to be proper. America is chronically deficient in vitamin D. Every single patient I have that comes in for Zerona has chronically low vitamin D levels. I'm like, well, my doc gave me 50,000 IUDs. It didn't take. Your levels should go up. This is a highly debated topic. The allopathic window of acceptable vitamin D in your blood panel is about 30 to 100. That's, to me, a little broad. That's a 70-point range variance that's acceptable. Vitamin D is a pillar of your immune system. We immediately look at patients' vitamin D. Why? Because patients with low vitamin D have a low immune system, and they also have a hard time losing weight or maintaining health. And it's a no-brainer. It's your immune system. Okay? And that correlates to your Krebs cycle, which is in the oxidative stress video. Patients with low vitamin D typically seek out the Zerona because they can't get results. And even when they're supplementing with vitamin D, they're not getting the proper form. So in our Zerona folder, we give you a handout, 4 pages, all about vitamin D. What you need real quick, you need vitamin D with K. It's a cofactor. The majority of vitamin D sold not through functional medicine docs is ineffective. Okay? So we also have a handout called systemic inflammation, which takes us to the next level. So our patients who come in, that's included in the advanced care folder. So a typical treatment. This is where some of my old patients who may be watching this video are going to kind of smirk, because you heard me say there are no constants in laser therapy, and sometimes this is frustrating for patients. But here's what we typically do. Check in. Our clinic is a little different at this stage. We've converted to full functional medicine. I don't have a waiting room, I have a lounge. I don't have a front desk. You see the doctor, the techs. We begin doing things right away. You'll do your Zerona treatment or your whatever laser we're going to use that day. Okay? Then you'll do vibration therapy, intersegmental traction, oxygen with exercise, etc., whatever we put into your protocol. You'll do a foot bath and a body scan. Now here's the deal. Okay? Since this is a whole body healing event, the order or manner that these things are done is not necessarily going to be a constant. It doesn't really matter once you're in the flow, because each treatment builds on the last. And so what a good laser doc does, they're going to modulate this order to get you the best results. So sometimes a patient will walk in, it's very obvious the lymphatics are completely full, in duress, and not clearing. So why would we start with the laser? We're going to start with some vibration therapy. We're going to look at skin tone and texture. Oh, looks like your lymphatics are under duress. Let's do a foot bath and get things moving, etc., etc. So there's a lot going on in a clinic that understands laser. And it's funny because a lot of my patients get worked up because I don't tell them the flow, but yet when we were doing traditional standard chiropractic, the #1 complaint was my chiropractor does the same thing every time. So it's a no-win situation. I'm chuckling because after 200+ thousand Zerona treatments, I have so many people bouncing through my head when I'm saying this who are probably going, oh, now I know what was going on. So, all right. Originally, the Zerona protocol, 3 times a week. But you have to remember, the first study, we did everything the same, or the researchers did, just so we could get a baseline, get the FDA approval. But you have to remember, a good functional medicine doc is not going to do the same thing every time. That's just not how this works. That's why a lot of traditional chiropractors and MDs have a really hard time converting to functional medicine, because they're very fixated in that allopathic mindset of here's how everything is done. We're going to focus on one thing, where a functional medicine doc is juggling 10 topics in their head at any one time and looking at all variables, where your other doc is simply looking at limited. And that's not bad medicine, it's just different type of thinking. So we treat 2 to 3 times per week. I do have patients that fly in that treat every day. I can only take a few of those because it's very intensive care. It's a lot of one-on-one time with the doctor. Okay? We have altered our in-house protocol, and I'll tell you why. We've gone down to 2 times a week. It's easier for patients to comply with 2 times a week. Everybody has a work-life balance. I have 6 children. I lecture. I attend lectures. I train docs. I have a personal life. I don't work Sundays at 8. Okay, if you want this, you will get here. You will make it happen. Okay, patients do much better with a work-life balance with 2 treatments a week. That's just what we find for basic body contouring. They budget 45 to 60 minutes per visit. Okay, that's just what it takes to do this properly. I had a patient come in and they went to one of those light clinics and they said, oh, the treatment was 14 minutes. Sure, you're going to get 14 minutes worth of results. Okay, spend an hour on your health. That's what we do. Okay, body scans are performed sometimes twice. Sometimes right away and sometimes at the end because I want to see what your body's going to do in an hour. Remember, body scans and blood work and imaging, it's all a snapshot in time. We're watching your body change. So there's a lot of functional medicine clinics where the patients fly in for a month. Remember, these are autoimmune people flying in to see specialists, spending a month of immersion care. They test blood work a couple times, and they're looking to see what the body's doing. Our thyroid patients, we can test their thyroid every month. And if you're hyperfixated on TSH and you think that's the only thing about your thyroid you need to know, you've only been told about 1/9 of the story. There's 9+ markers for your thyroid. We'll talk about that in our thyroid video because the #1 reason patients come to me is they have a malfunctioning thyroid. They've been told it's just fine. This is Functional Medicine 101. These are our autoimmune patients. Huge side note here, 2017, we proved, and you get the article in your folder, cold laser therapy, not LED light devices, not laser like lipo, not sham devices, but true cold laser, 635 nanometers specifically, was proven to regenerate and reactivate or restore and upregulate thyroid tissue. Okay, this is a huge, huge thing in cold laser therapy. So we'll have another video about that. So we're at the point now where we're actually, what I call going public. We're going to tell everybody about this because I think after spending 10 years in the trenches, I'm pretty confident to tell people about what this is. Key points, be patient. 3 to 5 days it's going to take to process each treatment. So many patients who come in just aren't patient. They come in twice and they're like, oh, this doesn't work. Well, no, what didn't work was you didn't listen, you didn't do the protocol, so you have no right to comment, okay? If you're not going to give it 28 days, it's simply not for you. Here's one thing that shocks a lot of patients when they come to me. We don't take every case. We don't take every person who wants Zerona just because they want Zerona. If this isn't how, if you don't connect with us and how we think and how we work, no hard feelings, but we're not going to treat you if this isn't for you. It's unethical, okay? If you want a place that will just treat you and off you go, you can have your pick of those clinics. They're everywhere. There's one across the street from us, okay? And I use the word clinic loosely with those places. They're not bad people. They're not breaking the law. They're just not doing the Zerona or whatever they have on the level that we are. So that's what I tell our patients. Elevate your perception. We're a doctor's office in dysfunctional medicine, specializing in cold laser. And more importantly, we get results. We actually invest time in our patients. And we want you to do well. Okay. And I say that because this whole concept of body image is so flippantly sold online as like, hey, no big deal, just show up, treat, and off you go. That's not how it works in our clinic. We're very thorough. Okay. So who is the ideal candidate? Understands the Zerona protocol is a process. This isn't an immediate fix, a one and done, and off you go. Okay. You didn't get this way overnight. Okay, and you want out of it. You're ready to heal. A lot of patients, we look at them, we go through their history, and say, you know what, you're not sick enough yet. Come back in 3 to 5 years when you're ready to take your health serious. We'll go to work. When you're sick enough, you'll be ready. And usually they go bounce around for 3 to 5 years. They see a bunch of specialists. They get sicker. They get less energy, et cetera, et cetera. They finally say, okay, I'm ready to invest in my health. Okay. You got to comply with the protocol. We give you all this information. If you don't show up and treat, don't expect it to work. If you skip your treatments because, you know, oh, today I just don't feel like putting my time in, then don't expect it to work. Each treatment builds on the last. We start in one area and move forward. You know, but if you're not going to show up and be engaged, why would you ever expect it to work? This is probably where I get a little annoyed because when you book your time out with us, we're setting that time apart for you. Okay, so that means we said yes to you and no to somebody else. If you're not going to make it a point to be here, don't sign up. Period. We only want people where this is a 10 out of 10. True story, I just had a patient, very probably younger, 20 years younger than me, didn't even bother to do any of her paperwork on day one. And I just said, well, we're not going to treat. This is it's unethical to treat you. You haven't completed your paperwork. I'm sorry. She didn't like me for that. She probably watched this video sometime and say bad things, but I'm sorry. You could not go to a doctor's office with incomplete paperwork and expect treatment. I'm sorry. It's just not how it works. But the problem is there are plenty of clinics or whatever that do the LED light things where you can just walk in, sign your name, and get treated. If that's the level of care you want, you've got your pick of those places. So, okay, patience. Give it 28 days. You will love the Zerona, because remember, no surgery, no pain, no downtime, best of all, no scars. It doesn't interrupt your day. It is very convenient if you're willing to put an hour in twice a week. Okay, lots of questions about the Zerona. When your therapist is treating you, that is not the time to interrogate your therapist about what this laser is or what it does. Your therapist is there to do the therapy, okay? We're not going to have hallway conversations about the science. In that moment, that is your time for us to focus on your healing. If you're going in for heart surgery, you wouldn't stay awake and say, hey, surgeon, what device are you using, what diameter, etc. No, let the therapist do their job, okay? You're going to have questions about laser. That's why we're shooting videos, okay? When you're in therapy, your job is to lay there and heal and relax and focus on your healing, not to interrogate the laser therapist or the doctor. I'm just saying that because everybody has a lot of questions. They want to know what's going on. Like, I understand it because it's very different. But remember, your therapist in that moment is trying to help you heal. That's where their energy needs to go, okay? Not into answering a question that's answered in the video. I say that because we get these questions 20 times a day, just like my MD friend who gets 20 questions about the pharmaceutical commercial that so-and-so saw last night, okay? Trust me, our clinic, we put in 20 years to do what we do. Everything we're telling you in these videos now, this is a 10-year journey. We didn't want to come out and say these things till I felt, hey, we have enough time to be an authority in this, okay? I think 10 years, that's a long time. And I'll tell you, it's gone by. I can still remember Zerona day one. I remember the day I gave up a year's salary for this thing. I was young in practice, 2 young kids at home, and I spent this money. And here's this thing sitting in my office with no cookbook. Nobody's done this. There's no one to copy. And I'm like, okay, I know this works, but this is a huge leap for us. And it changed our practice. It changed my life. Number one thing I tell docs who train with me, you buy a laser for you. You use it on your patients. And I stole that from one of my mentors, Dr. Dan Murphy. So I literally took Dan Murphy's laser manual. I think in 2008 or 9, I saw him, and I studied that manual backwards and forwards and every bit of laser information at a time. And then I took that information and created a laser clinic. That's why we're so different. That's why we're so good. That's why we have all 3 lasers, okay? That's why we were the first clinic to take the green laser public, okay? A lot of people don't understand this tiny little hidden clinic out in Maple Grove, Minnesota. We're cutting edge on cold laser. We love it, okay? There's so much going on with this. I know you have a lot of questions, but remember, when you're here for care, it's your time for healing, not your time for questioning, okay? Can you do the laser 1 time a week? Can you do it for maintenance? Can you do it? Yes, there's all these things that can be done, and these questions we go through when we write your protocol, okay? Who's not an ideal candidate? Well, in this type of care, obviously, compliance is a major concern. When patients are pregnant, we don't do anything elective, okay? Even if you're nursing, our rule is laser therapy. There's no studies either way, but if you're nursing, we want baby to not change their eating routine. But we can maybe do some pain reduction, but if it changes your metabolism or your body physiology, etc., and baby's not eating, we don't treat. That's true in anything, not just laser. But it's the compliance. And we tell people, after watching our videos, if this isn't for you, no hard feelings. Trust me. 5,000 patients, and they just keep coming. We're not worried if people don't want this. We have year 1, when there was 1 Zerona, we had people lined up in the lobby, and they would wait for their Zerona treatments. And then there were 2 Zerona clinics, and we couldn't keep up with the demand. Not too long after the sham devices were launched, and our workload only lessened about 20%. Because when you don't get results, people don't come back. It's that simple. Okay. So, recapping the Zerona, or what you know as lipo laser. It's not an LED light. It's not laser like lipo. It's a true cold laser. True cold laser is a paradigm shift in medicine. Right now, at this point in time, this has been going on for a few years now, chiropractors are notoriously good with cold laser for pain reduction, tissue healing, etc. Physical therapists are getting on board. Veterinarians do phenomenal. Here's why. Veterinarians take the laser, the one that we use in a different form, it's put into a handpiece. They put it on their patient for chronic pain, etc., but they also do it right after surgery. And the patient heals 3 times faster because it's all everything about the Krebs cycle and all that. True story, my oldest son had foot surgery. I took our laser to the hospital, and the doctors and surgeon there, they had never seen a cold laser. They were freaked out. I had to provide literature that it wasn't harming my child. I'm like, we're going to put this laser on him post-surgery, and he's going to heal faster and take pain down, and it did. But you have to remember, cold laser is still at that point where it is not everyone's doing it. It's getting there. You know, we're at 2018 now. It's getting there, but it's not where it's going to be. In 20 years, it'll be so common you won't think twice about it. And I think we're about a third of the way there. The problem is there's such a hard learning curve with the laser because it's so perceived as extremely simplistic, but yet when you get into it, it's extremely complicated. Okay. When the Zerona came out, 2008, there was never anything like this ever in medicine, nothing even comparable. More so, there was no one doing this, okay? No one. So we took a huge leap of faith and created this, okay? Nothing's ever been done like this. I can't express this point, and that's why the Zerona, you see such, people just do so phenomenal because they go into a doc who understands it. They actually get a real laser. They get real treatment. They get proper care. You know, our record for 2 weeks is over 18 inches. Okay, that's pretty phenomenal with no surgery. Okay, and that's quantified with the body scan. Okay, but you have to remember, the Zerona set the standard for this. The sad tragedy is what came after, and this is true in any industry. And so both these guys get credit for this quote, and I use it when I'm training my docs. Warren Buffett, Mark Cuban have been quoted as saying, in anything, first are the innovators, and I'm paraphrasing. Then they're the imitators, and lastly, the idiots. And I only say this, I'm not judging people, I have to put this out there, because 90% of these devices on the market now we consider to be in stage category 3 of this quote. I'm sorry. LED lights are not new technology, they're not better technology, they're not whatever. We are a laser clinic, we use cold lasers. We've had every copy of the Zerona made, okay? And when I say this, most patients have no idea that an LED light being sold on an internet coupon is not the same as a Zerona because they're sold with the same verbiage, okay? They're shocked when they come in that, oh my, this is a doctor's office. I thought I was going to a hair salon. No, this is a doctor's office, not a hair salon, okay? Now, I could flip that. I could cut your hair. It would be a haircut. I don't think you would want that, okay? You could go to a hair salon for laser like lipo. Will you be happy? I don't know. Okay, do you see I'm being facetious? So we've had every copy of the Zerona. The original imitators have all been sued out of business for patent infringement or have moved on to the next industry. So now what we're left with are the innovators. Zerona docs barely have to market, okay? So busy with referrals. The third tier, these are the people, not only do they come out, and this is straight, paraphrasing Mr. Buffett and Cuban, not only do the idiots come out and stand on the shoulders of giants, but they actually ruin the industry that they're trying to infiltrate. And they come in, and you can think of any industry where these people just come in and they just so grossly, you lose so much value because of these people. And eventually they move on. The sad tragedy of the Zerona are what the idiots have done to this industry. And that's going to offend a lot of people. I'll probably write a ton of negative comments, but it's true. I'm sorry. LED lights do not stack up to lasers. I said it, I put it out there. So that's that. We're a laser clinic. We are not an LED light clinic. If you want an LED light, run down to Home Depot. They're like $5. Okay? That's that. I said it. Okay. Moving on. Here's the deal. You will not find copies of the other lasers. The red laser has been copied, okay? Well, the manufacturer learned a few things after the first time out. The Virgil, or the 532 nanometer green laser, is a step up and a sidestep from the Zerona. Does everything the Zerona does and more. It works in the collagen matrix, it works in white matter. Going back to one of my mentors, Dan Murphy, I will quote him because I think he is the premier laser doc. He puts himself out there teaching docs. I don't know how he manages his schedule. His exact quote to me in a room full of docs is, "We covet the green laser, yet you will be hard-pressed to find a green laser in many clinics. You will not find a sham device that is a green spectrum." Now, the EVRL goes by a few names. Originally, it was called a dermal laser. We have the first one from 2008. It's a 405 nanometer purple laser. Okay, now it's being reborn because the purple one is very complicated to master. Okay, it's very powerful. It doesn't need a lot of diodes. It's so powerful. True story. We were in a laser seminar. Guy behind me is just, you know, all this laser stuff is blah blah, this, that, the other thing. I feel for my friend Robert Silverman, who was giving the lecture. I'm sitting there. We're connecting. Yep. I'm not saying a word. So Robert calls this fellow up front. He does a purple therapy for neurology. The purple laser will calm down your sympathetics, which is your driving side of your brain, bring up your parasympathetic, means it shuts you down. Immediately, this doc who had been with a bad frontal lobe because he couldn't stop talking, immediately began to shut down. He was blown away. He eventually did get a laser, but I think it became too difficult for him to manage the patient load. I'm not sure, because it's very complicated. But these things are very powerful. When you're going in for laser, if your doc doesn't have a couple different lasers, they're probably not really as immersed in this as they could be. We're very immersed in it. We have all of them at this point, and we have lasers that travel with us. Okay, so I know it's been a lot of information. Thanks for watching. I hope it helps. This is the beginning of your Zerona journey. Now, the second video is a little more exciting. There's pictures and diagrams, and you get to see more of the aesthetic end. This is more of the logistical end. I'm Dr. Don Jewell. Our clinic is non-surgical clinic, nonsurgicalclinictc.com. So remember, when you're going in for body contouring or cold laser, make sure one thing, that you're actually getting a laser. It's a true laser. You can call them and they will tell you. Here's the deal I tell everyone. When you have the Gucci purse, you tell everyone, I have a Gucci purse. When you have a copy, you make up a word like laser like lipo. When you have a Ferrari, people know it. When you have a Fiero with a Ferrari body kit on it, people in the industry know it, okay? Once again, that's going to generate a lot of backlash, but it's true, okay? And in our clinic, we don't have to bend the truth because we actually use FDA-approved devices that get results, okay? So once again, I hope that helps, and watch the second video, and we'll talk to you soon.